Mabuhay! This is LU7's presentation about the individual and collective responsibility in connection to the contagious COVID-19, which started in Wuhan, China last December 2019. The most common symptoms are fever, cough, tiredness, and loss of taste or smell. In the Philippines alone, there are approximately 2.85 million cases and more than 50,000 deaths. This virus don't discriminate whether someone is rich or poor and young or old. No matter who you are and whatever status you have, you are vulnerable. It has reached all parts of the world and has affected every sector. Many Filipinos have lost their jobs in 2020. Lockdowns were imposed throughout the country, the food supply has run out, and bankruptcies were filed one after another. Problems? Name it. This pandemic is a test of preparedness, unity, resourcefulness, camaraderie, and endurance. The question is not about who's to blame for the current situation, but with this happening in the present, what our plans are. As an ordinary citizen, health worker, armed forces, politician, and the government, what is your contribution to stop or somehow alleviate the situation? The frontliners are our modern heroes. They are the first respondents and those that has direct contact to the infected. The fear of the unknown has influenced some professionals to not respond to the call. Some hospitals are even accused of turning away COVID-19 positive patients or even suspected cases. It is the duty of the health workers to cure and heal sickness. But it is human nature to think of yourself and your family's health above everything else. It takes courage and commitment to serve, especially during these trying times. Protocols such as wearing a face mask, social distancing, frequent use of disinfectants, and avoiding mass gathering were enforced. Law enforcers go hand in hand to monitor the implementation. Safety is prioritized. Although these rules may seem simple and very easy, it still depends to the citizens, us, to follow and cooperate voluntarily. Due to the lockdown and various restrictions, businesses were forced to declare bankruptcy or be temporarily closed. To minimize cost, cut on losses, and allow the businesses to survive, owners and HR departments let go of probationary workers and even permanent employees. There are also situations wherein salaries were not fully allocated due to lack of funds. Some even choose to continue working despite the discounted or lower salary provided. With the pandemic happening, profits were close to zero. Still, there will always be opportunists who thrive and pounce on the weak. Contracts must be honored, standard products and services must be offered and provided to avoid compromise. The governing body of the country plays a big role in our daily lives and also during emergencies. The public servants are tasked on thinking of solutions to keep everything from falling apart: the economy, healthcare system, and security. Serving the country is not about building infrastructures and visible roads, but implementing projects that benefit the people as Filipinos. It is a test to these politicians on how they respond to the COVID-19 situation. Some took advantage of the public opinion as they donate to charities and be present to the most followed events to promote themselves. So, if we were to be asked again, who is responsible for us to heal and progress? Is it the government, business sector, armed forces, or health workers? No one. It is with collective effort that our country can survive and that we can get past this. Ayuda, a monetary and food support for every family, is one of the solutions of the government to aid its people. Mostly, distributions are based on registered voters, so it's inevitable that politics will be involved. While bayanihan is a common Filipino trait that distinguishes us from other nationalities. Although donations are highly encouraged, especially to those who are privileged, this don't limit it to specific people with greater means. Barangay Community Pantry is a project where people drop whatever food they could donate, such as eggs, fresh fruits and vegetables, canned goods, instant noodles, and the like. It is complementary to the Ayuda, a national program. This aims to provide food to those who are in need within the community. It is tempting to get as much as possible, but in this time, one should be aware of how much they need to avoid spoilage. Virtual class, work from home setup, and online business is the new normal. It stands to reason that life will still go on despite the new challenges. Small business is a great way to provide for the family. Although we are only virtually connected and there are hindrances such as internet connection and lack of resources, it's still possible to build meaningful connections that will serve as our support and vice versa. The health workers are heavily burdened due to the workload. Overworking in this industry is not advisable as it will weaken the immunity and health state of these heroes. This will make them prone to sickness that may lead to decrease of workforce. Good thing, there are volunteers who offered to help, some for free while others for small amount of money or food. It can be seen that in this current year, 2021, the situation has been stabilized. Doctors, nurses, and laboratory technicians are now entitled to rest, not just to replenish their energies, but also to have a fresh mind so that they will be more productive in the long run. With the formulation of vaccines, the end of this pandemic seems so close. To ensure that it's safe and will not bring any harm, some leaders have volunteered to be the first to receive a vaccine. Still, there are people who are not fully convinced as to its safety and effectivity. The government has prioritized the elderly and sick as they are the most vulnerable. The workforce has followed to boost our economy. Some organizations have allocated a part of their funds to provide relief to their chosen communities. There are also companies such as 7-Eleven that gave 1 million masks to the Federal Emergency Management Agency for the distribution to the medical community and those in need. If the health workers, government, and business sector has already did their part, then as citizens, what are we still waiting and asking for? Their help and contribution is just one side of the coin. The ball is in our court. The immediate recovery will depend on how we respond with all the tools and help already given to us. In a society where everything is interconnected, it's just right to do our part.